Algorithm for the initial evaluation of a patient with weakness. From screening for anemia and hypothyroidism to assessing for heart failure and depression. The algorithm for the initial evaluation of a patient presenting with complaints of weakness should begin with screening for common reversible causes, such as anemia and hypothyroidism, through history taking, physical examination, and laboratory tests, including a complete blood count and thyroid function testing. Assessment for heart failure involves evaluating symptoms such as shortness of breath and edema, physical signs of hypervolemia, fluid overload, measurement of B-type natriuretic peptide (BNP) levels, and echocardiography to confirm cardiac dysfunction, with particular attention to diagnostic challenges in patients with obesity or comorbidities. Screening for depression should include the use of validated questionnaires and a clinical interview, as depression can contribute significantly to the development of weakness and fatigue and may require pharmacological treatment and supportive therapy. If anemia is detected, further diagnostic investigation should include an assessment of iron metabolism parameters and consideration of other causes, such as bleeding or malignancies, as anemia in patients with heart failure is a common phenomenon that often remains undiagnosed. The algorithm should also integrate the assessment of other contributing factors, such as nutritional deficiencies, medication side effects, and chronic diseases, through a thorough history and physical examination. New tools, such as artificial intelligence-based diagnostics, can improve the early detection and management of heart failure and related conditions in complex clinical cases.